With nearly 100 cases in Gaines County now, we are up to 146 measles cases in West Texas, as reported today from the State Health Department. Here in Lubbock County, there are still only 2 cases, but this is where 20 children are still hospitalized now for measles complications. The national media was in attendance again today, and as Lubbock health officials held a news conference to answer questions and clear up what they call misinformation about measles. After the first measles death was announced this week, the biggest concern is containing this outbreak before there are any more deaths.
This outbreak is going to continue to grow.
But today, some encouraging news that the message to vaccinate is reaching people and changing minds.
Yesterday, our clinic vaccinated over 50 children, and actually 11 of them had a previous exemption.
It has been a school requirement in Texas that children be immunized at 12 months and again between age 4 and 6. So what about infants? Dr. Ron Cook explained today in a Zoom conference that a measles exposure is reason enough to offer some protection earlier.
We can vaccinate a 6-month to 12-month-old early, especially if they're exposed.
Talk to your pediatrician to know what's right for your infant. The Zoom today was also an effort to clear up some misinformation on social media. For one, that the idea of a measles party to deliberately infect a family to build immunity is a dangerous idea.
It's not good to go have measles parties, because what may happen is we can't predict who's going to do poorly with measles, be hospitalized, but potentially get pneumonia or encephalitis and or pass away from this.
Also, that large doses of vitamin A will not prevent or cure measles. He says there is no antiviral treatment for measles, and vitamin A could instead cause other problems.
So it stays in your system. We just can't pee it off. It's not a water-soluble vitamin. It's a fat-soluble. So when you give those big doses, that could cause lots of problems.
Dr. Cook also emphasized there is no link between the MMR vaccine and autism.
It is absolutely not associated with autism. That's been disproven, and that should have never been started.
And what about all those people who think they may have a natural immunity from some exposure earlier in life?
Karen, maybe. I would not take that to Vegas, nor risk my life on that.
So if you don't know if you've had measles or the vaccine, you can get screened to see if you have had some measles exposure, or you could just go get the vaccine to be sure you are protected. You can find information on where to get the vaccine at kcbd.com.